Hello, I'm Dr. Matt Korn. I'm the chairman of the California Dental Association Foundation Wellness Committee. And this morning I have the privilege of interviewing Dr. Robert Hanlon, current president of the California Dental Association. Good morning, Bob.
Morning, Matt. Good to be here with you this morning.
So you spoke at the CDA 2025 CDA House of Delegates about an experience that really changed your life. Can you walk us through what happened?
Sure. I was vacationing in Orlando, Florida with my wife, childhood best friend who I've known since I was three, and his wife. I'd had some pretty severe intermittent lower back pain the week before. I went to an urgent care to get checked out before I left for Florida, and I was told it was probably muscular and not disc, given some Vicodin and sent on my way. A couple of days later, March 16th, 2015, a date that I'll never forget, I'm in Orlando, and the four of us go to dinner at the hotel restaurant, and I'm just not feeling well. We went back to the hotel room, and I just collapsed and fell back on the bed. My wife, Laura, immediately realizes, that something is wrong and called 911. I never lost consciousness, but a lot of the details, are kind of fuzzy. I remember the EMT showing up. I remember being wheeled down the hotel hallway on a stretcher. I remember being in the back of an ambulance with the EMT yelling up to the driver, "Hit it," because at that point my body temperature had reached 107.3. I can remember being wheeled into the ER and lying there under the bright lights. I had IVs in both of my arms and they're pumping cold saline into my veins, and nurses are just packing ice around me, like I'm a dead fish. I could move my fingers and toes, but I couldn't really move my arms or legs. I could hear my wife's voice in the background, but I couldn't really turn my head to see her. She maintained a sense of calmness and humor throughout this entire ordeal. At one point, I remember a nurse asking my permission to cut my shirt off. And I was wearing a CDA Care shirt at the time, and in the background, I hear my wife yell out, "Go ahead and cut it off. He has a whole drawer full of them just like it at home." I remember this period where I was lying there and my heart rate started to elevate, and the ER doc is leaning over me calling out 160, 165, 170. And I'm just lying there completely motionless, and my heart is pounding out of my chest. 190, 195, 200 beats per minute. And I looked at the ER doc and said, "I'm going to die, aren't I?" And he didn't respond or say anything back to me. He just kept looking at the monitor. And, soon after that, my heart rate started to drop and I was stabilized. And they did a CT scan and was able to localize an abscess on my spinal cord. A couple days later, I had a neurosurgeon do a spinal laminectomy to go in and debride the abscess. And over the next couple of days, I saw numerous specialists who all said to me either, "I've never seen an adult patient with a fever as high as 107, or I've never seen an adult patient with a fever as high as 107 live." And so, as I've said to many times before, I came as close to dying as you can without actually doing it.
Wow, that is an amazing story. After going through all of that, when did you start to feel like you needed to make sense of it all?
I had a very difficult time making sense of it all. At first, there was this huge sense of gratitude that I was alive and I was going to be okay, that my wife wasn't going to be pushing me around in a wheelchair the rest of my life in some vegetative state. The only long-term physical effect is that my left foot is permanently numb. And that's pretty remarkable, all things considering. I went through this period of questioning. Why did this happen to me and how do I prevent this from happening again? And, a decade later, I still don't have answers to those questions. I have infectious disease doctors on both coasts, just kind of baffled. The infectious disease doctor in Florida told me he normally runs the culture for 7 to 10 days. In my case, he ran it for 21 and still couldn't make a definitive diagnosis of the bacterial species that caused this. Part of this has to do with the fact that once I got to the ER, they just started pumping me with every antibiotic known to mankind. I'm never going to get the answer to why and how. But I became depressed. And I think a big part of it was that I lost my identity of who I was. I was out of work for 3 months. I was the CDA PAC chair at the time, and I couldn't attend any meetings or political events. Both my children had gone away to college and were out of the house. And I know this may sound bizarre to some people, but I couldn't ride my bike. That's a huge part of how I identify myself. To the core of who I am and encoded within me, I am a cyclist. I have been my whole life. I got my first racing license in 1970. I ride between 5,000 and 7,000 miles a year, around 100 miles a week. And suddenly that was taken away from me. And all of these things together sort of led to this loss of identity as to who I was, and I became despondent over it.
Well, as a fellow cyclist, that can sure relate to what I call cyclotherapy. So I was taken away. I don't know what I do. But at one point, did this become more than just a physical recovery?
So, it was clearly a physical recovery, okay, and there was also a psychological recovery, and they were very much sort of interwoven together. Being out of work and not being able to do any physical activity just gave me a lot of time to think and read. And I stumbled into Ryan Holiday's first book on Stoic philosophy, The Obstacle is the Way. And the impediment to action advances action. What stands in the way becomes the way. The obstacle is the way. And Ryan has this modernized definition of Stoicism, which is that a Stoic believes that you don't control the world around you, but you do control how you respond. And a Stoic responds with discipline, courage, integrity, and wisdom. And the book just sort of resonated with me. And I just started studying Stoic philosophy, reading Seneca and Marcus Aurelius and Epictetus. And it really helped me get a handle on accepting what happened to me. Amor fati, love fate.
So it sounds like you realized that maybe there was a reason behind all this. Tell me about how meditation helped you work through any anxiety or negative emotions you had as a result of the experience.
Well, I agree with you about psychotherapy. Up until then, until this day, I consider cycling a form of meditation for me. I spend 10 to 12 hours a week on my bike. Saturdays I ride with a group, but I spend 7 to 10 hours alone on my bike riding the rural roads of North San Diego County. And some of that time I spend listening to podcasts, some of it I spend listening to audible books, but a lot of it I just spend alone with myself just thinking. I do some of my best, clearest thinking on my bike, and for me, this is meditative. I may come back from a long, hard ride with my legs aching, okay? But my head is always clear and energetic. Following my hospitalization, I had a lot of time on my hands, and that's sort of when I started a semi-formal practice, okay, of meditation. I started with an app called Headspace, founded by a former Buddhist monk. And there's a lot of different meditation apps out there, and you just have to find one that you can relate to, where the voice is something, okay, that you kind of find soothing. At the time, I was having a very difficult time sleeping at night. I would wake up multiple times a night and just relive the experience again in my head. And I would go out in my backyard, and at the time I lived on top of a hill that overlooked a valley. And I would just sit there and listen to these guided mindfulness meditations. And, most of them are just 10 minutes long, but that 10 minutes would just allow me to kind of clear my head and reduce my anxiety and just allow me to relax and get a restful night of sleep. I know many people who meditate first thing early in the morning. It's not something that I do, but I do periodically meditate at lunchtime for 10 minutes if I've had a particularly stressful morning at work. And I still meditate every evening for 10 to 20 minutes, before bed. And in the words of Marcus Aurelius, today I escaped from anxiety, or no, I discarded it because it was within me.
Wow, your experience is very unique, but the feelings you just described, I felt them. The stress, the anxiety, the uncertainty of it all. Those are things that I think most dentists feel without a life-threatening kind of event. But for dentists listening to this who might be struggling quietly out there, what would you want them to hear?
Don't go it alone, and don't ever be afraid to ask for help. Asking for help is not a sign of weakness. According to the ADA Health Policy Institute, 82% of dentists feel major stress in their career. There's help out there for you, and CDA is there to support you with that help. The CDA Foundation Wellness Program is a source of support and assistance for dentists who are battling physical and or mental issues, including anxiety, depression, or substance dependence. The program advocates for the overall well-being of dental community members and their families with confidential peer-to-peer support and hands-on assistance. Go to the CDA Foundation website and click on Wellness Programs. It will bring you to the landing page where you can navigate all the resources that the foundation has to offer. These resources offer support to dentists and their staff, across the entire wellness spectrum. There are phone numbers there for regional representatives throughout the state that you can contact 24/7.
But how can leaders like yourself in organized dentistry help create the space for more open conversations around wellness?
As leaders, we have to destigmatize the negative connotation that comes with having physical, mental, or substance abuse challenges. ADA past President Brett Kessler was certainly very open and forthright with his struggles with alcohol. You, Matt, are very open about your struggles. I'm certainly willing to sit down and talk one-on-one with anybody, about the struggles that I've had or the struggles that they're having. And I hope that leading by example will allow others to be more open to conversations about their own personal wellness. But as leaders, sometimes what it really takes is the courage to just reach out to a colleague who just isn't his or her usual self, and just asking them how they're doing. Starting a conversation, listening to what they have to say. We're all leaders in this battle, and we need to embrace our roles as friends, colleagues, and members of the dental community. We need to do a better job of taking care of each other and taking care of our own.
Well, and you and Dr. Kessler have certainly done that. Thank you for sharing your story. I think you know that Dr. Kessler played a pivotal role in my early re-entry into dentistry after my struggles with addiction. And it just felt great to know that someone was there that cared, and that I'm really proud of the way we've shaped our profession moving forward. This is the obstacle, and this is the path. So thank you very much for your time. Appreciate you.
Thank you, Matt.